How to spot diabetes. Early and take action before it's too late. Know sure whether you have diabetes or not and searching only by the symptoms? If you manage to find out that you had a case of diabetes early on, it will help you stay away from many health problems and lead you to a more active and healthy life. Some of the major symptoms to look out for are urgency in urinating, feeling extremely thirsty, losing the unwanted weight without any reason, seeing things that are not very clear, and the cuts or wounds that take a lot of time to heal. It is necessary to act promptly in case you or those who are on your care are experiencing one or several of these signs. In this article, we'll cover the following issues. Warning signs which may support you to catch the disease at an early stage. Daily habits which are easy to apply and can reduce the odds of getting the disease. Do you know who are the most susceptible and their reasons? How you can manage your blood sugar with bits of advice from the experts. You being alert at the early stage can really make a difference. Doesn't matter if you or your loved one is affected. So that's a good time to start learning. What is diabetes? Diabetes is a condition which affects the way your body uses the glucose, the main energy source for your body. If insulin, which is a hormone that regulates your blood sugar, is not sufficient or is not effectively utilized by the body, then the glucose will stay in your bloodstream instead of supplying your cells with energy. The two main types, type 1 diabetes, is often found in children and young adults. It is an autoimmune disease. The body's immune system mistakenly kills insulin-producing cells, and so the patient has to take insulin for the rest of his life. Type 2 diabetes is more common and occurs gradually. This is due to insulin resistance or when it's not produced in high enough quantities. Lifestyle choices such as unhealthy eating habits and not having a healthy lifestyle often cause the disease. Other kinds, gestational diabetes, affects some ladies only during the time of pregnancy, and after delivery it normally goes away. However, it can lead to the development of type 2 diabetes in the future. Among the rest, there are also very rare types such as monogenic diabetes and diabetes due to cystic fibrosis. Each classification mandates a special kind of therapy. Ignore this and you will be in trouble, so knowledge of them is a must. Warning signs. You must not overlook physical symptoms. Be attentive to your feelings. Some of the initial signs indicating that something is wrong are as follows: excessive thirst and frequent urination. Your kidneys are trying to eliminate the excess of sugar. Unexplained weight loss. Your body is burning muscle and fat as it cannot turn sugar into energy. Blurry vision and slow-healing cuts or bruises. High blood sugar affects your eyes while it also hampers the healing process by slowing it down. Behavioral changes. Furthermore, diabetes affects not only your physical, but also your mental aspects. You can experience the following: worn out for no clear reason, irritable or moody, hungry all the time, even right after eating. If you are noticing the changes, make an appointment with your doctor as soon as possible. Who is in the most dangerous situation? Factors which cannot be controlled. There are some things you are powerless to alter. These include situations like family history. If diabetes already exists in your family, your risk is higher. Age. After the age of 45, risk starts to increase. Ethnicity. African American, Hispanic, Native American, or Asian populations are more likely to suffer from the disease. Health factors. Excess weight. There is a strong link between belly fat, which can cause insulin resistance. Lack of exercise. Physical inactivity. Your body less efficient with insulin. Poor sleep and chronic stress. These can throw off your body's ability to manage blood sugar. How is diabetes diagnosed? Common tests. Here are some tests that a doctor usually uses to diagnose diabetes. Fasting blood glucose test. This test is done after you have not eaten anything for at least 8 hours. A level of under 26 mg/dL or higher can mean that you have diabetes. A1C test. It shows how much the average blood sugar value is over a period of 2-3 months. If the value is at least 6.5%, it is very likely that you have diabetes. Oral glucose tolerance test. It is often used during pregnancy or if other results are not definite. Your doctor will take the test that is right for you and also that you need it regularly the most. How to prevent diabetes. Eat for blood sugar control. If you learn basic changes in your meals, the following options for your mission of glucose control would work wonders. Use the plate method. Fill half of the plate with vegetables, a quarter with lean protein, and a quarter with whole grains. Small changes in your meals may make a big difference. Utilize the plate method. Whole grains, lean proteins, and a lot of vegetables must be your choices. Start with water or unsweetened beverage. Do not use sugar. Go for low glycemic foods. Regulation of blood sugar is necessary for health. Move your body. One of the functions of exercise is to help your body become a more efficient user of insulin. Working out for 150 minutes per week of moderate activities like walking, biking, or dancing will support your attempt to control your blood sugar level. Additional strength exercises 2 to 3 times a week will help to enlarge your muscles and for better blood sugar control. Stay active during your day. Just walk as much as possible, stretch, or use stairs when you have the chance. Staying on top of your health. Don't skip checkups. Regular doctor visits can help you avoid potential health issues. At these checkups, you can monitor your health status using this list as a guide. Blood sugar, blood pressure, cholesterol, eye, and foot health. In case you have some risk features, it's possible that you will need to meet your doctor more frequently. Moreover, recording your own measures in the meantime of your normal visits can make it even easier for you and your doctor to develop a suitable plan. Final thoughts. Don't expect your symptoms to be big before you decide to act. By getting to know the early signs and introducing just a few healthy lifestyle changes, you will be able to lower your risk of getting diabetes and to feel fit and well. Start with the lowest steps. Just eat more veggies, go for a short walk daily, and have your blood sugar checked. Also, share this guideline with your friends and relatives who may have an adjustment. And one thing to remember is that your health is in your hands, and prevention should begin at present.